In the health center tonight, India overwhelmed by a devastating surge of coronavirus cases, depleting the country's supply of life-saving oxygen to critical levels. Many patients have died waiting on medical treatment. Trains carrying tankers filled with liquid oxygen have been making their way across the country tonight. And joining us now to talk more about the crisis in India and the status of COVID-19 and vaccines around the world is Dr. Andrew Neumer. He is an associate professor at the University of California, Irvine. Doctor, thanks for joining us.
Pleasure to be with you.
Well, we know India is the epicenter, it seems, right now for the pandemic. Can you give us a better idea of just how dire it is and also how this could impact our efforts here in the U.S.?
Well, India is a large country, 1.3 billion people. And, you know, the thing that your viewers have to realize is that there could be, a billion cases of COVID in India before the pandemic reaches herd immunity there. And, that's just a staggering number. And so, I mean, the nature of exponential growth is that it looks really slow at first. And, 4 weeks ago or so, you might have had people wondering, why aren't there a lot of cases in India? But then when it takes off, it really takes off. And that's what we're seeing in India now. And parts of the health system are overwhelmed.
And on the vaccine front today, switching gears, it seems that the U.S. is now going to be sharing its doses of the AstraZeneca vaccine with other countries after it, of course, goes through those safety checks. Do you think this will impact our response to the virus?
Well, I think it's the right thing to do. I mean, we're not using AstraZeneca here. We have the other three licensed vaccines. And so if we're not using it, we should share it. And as we've seen with India and other countries, no one is really safe until the whole world is safe. And so we're going to need to vaccinate, everyone on the planet who wants a vaccine. And that's a lot of people, billions.
And we're seeing more and more states now restarting Johnson & Johnson vaccines after that pause due to rare blood clots, and it comes with the warning now. What is your take on its perception right now?
Well, I mean, I'm sure a lot of the NewsNation viewers are wondering, well, is this safe or not? I mean, first it was on and then it was off. I mean, the bottom line is that I believe it is safe. I think pausing it was the right thing to do so the FDA could, take a very close look at the data without, the urgency of the vaccine continuing to be given. It does have, slightly higher rates of blood clots compared to the other two licensed vaccine, Moderna and Pfizer. But, the overwhelming weight of the evidence is that this is safe, and it's safer than, going at risk to COVID. So it's the right thing to do to restart it. I understand a lot of people are going to be apprehensive about it, but we need all the help we can get, and it is a one-dose vaccine, so a lot of people don't want to do the 2 doses of Pfizer. So it's a good tool to have in the fight.
Well, Dr. Neumer, we really appreciate your expertise, especially for helping us understand what's happening in India tonight. Thank you so much.
Thank you.